Hello, we'll be covering Chapter 61 today, Communication in the Dental Office. So the basis of what we're talking about today revolves around how we are different as people. When we're working in a dental office, we'll come across a large variety of different people, whether they come from different socio-economic backgrounds, cultural backgrounds. Not every single person is alike. So we need to understand these differences and hopefully gain some information from them and also just use it to our advantage to give them the best experience possible. So this can include verbal and nonverbal communication throughout the office. So just keep that in mind as we cover the rest of the information for this chapter. It all kind of revolves around getting to understand different people. So some of these differences can include gender, race, cultural heritage, age, physical abilities, and even spiritual beliefs. So let's talk about some significant people in the psychology world. First, Sigmund Freud, you may have heard of him before, but he thought that people have conscious and unconscious thoughts, and that our main purpose in life is to control our instincts and the power of these thoughts. Then you have Erik Erikson. He thought that a person's identity is individual, and that it comes from the past and from one's heritage. This would include their culture, religion, and their status as well. And then Carl Rogers thought that human beings are intrinsically good and friendly, and a person is born with these qualities, but over time, as they interact with society and their surroundings, it can lead to negative qualities within that person. So he essentially said everyone's born good, and they learn negative patterns. Next, we have B.F. Skinner, who assumed that behavior is learned as well. Any behavior that is a threat can be changed by learning to solve problems. He also said that positive behaviors can be acknowledged by positive reinforcement. And then lastly, we have Abraham Maslow. He is the founder of social learning psychology and thought that humans just cannot live without needs. He then categorized these needs in groups with different rankings and titled them Maslow's hierarchy of needs. So at the bottom of this hierarchy, it has psychological needs such as air, water, food, shelter, sleep, and clothing. So we need to meet those needs before we can go to the next tier of the pyramid, which is safety needs, including personal security, employment, resources, health, and property. We must meet those needs before going to the next step, which is love and belonging. That includes friendship, intimacy, family, sense of connection. On top of that is an esteem, which includes respect, self-esteem, status, recognition, strength, and freedom. And then lastly at the top is self-actualization, which is the desire to become the most that one can be. You must meet all of the needs below that top need before you can actually accomplish self-actualization. So Maslow's work is very important across all aspects of learning, not just psychology. I just recently learned about him in a healthcare management course that I'm taking, so his work is still very important to this day. Next, let's discuss social attitudes and peer pressure. So as a person grows and develops in their life, social attitudes then begin to influence how that person behaves and how they think as well. And then we tend to internalize the attitudes of others around us by making their attitudes our own. So think of it when you're a child and you're looking at how your parents act, you're going to pick up those skills from them, and that's how you're going to therefore grow up. If you're around a bad crowd, you're going to pick up bad traits. If you're around someone with high morals, you're going to have high morals as well. And then peer pressure, again, this can be a negative thing where we tend to adapt our behavior to just fit in with a certain group, even if we may not morally feel that that behavior is right. Peer pressure is often seen when a person conforms to the general behavior of a group of their peers in an attempt to feel more accepted within that group. And peer pressure can have a negative effect if you're around the wrong crowd, or a positive effect if you're around good people. Next, let's talk about communication. What is communication? It is the sending of a message by one individual and the receiving of the same message by another individual, so from one person to another. Effective communication is one of the most important aspects of our job as a dental assistant, an EFTA, a hygienist, even a dentist. Anyone in the dental office really needs to be able to communicate effectively. So this communication can either be shown by actual words, our facial expressions, our appearance, gestures and mannerisms, how well we listen, our voice inflection, and then also our attitudes and actions. There are two general categories of communication, one being verbal and then the other being nonverbal. So let's start with verbal communication. It is made up of the words that we actually speak. Words are important. I'm sure you know that. Always select words that will not frighten the patient or intimidate them, upset a patient. We don't want them to feel like they're judged by us for something that they did. Voice quality, we should have a pleasant tone and speak slowly and distinctively so that the patient can understand us. And then we should ask questions as well and allow the other person we're talking to ask questions back to us. These questions can be close-ended, where the patient doesn't necessarily need to respond, or else open-ended, where the patient can respond. Then we have nonverbal communication. So nonverbal communication, it's pretty much through our senses and our mannerisms. So it could be our body language, the messages we send, and the way we carry ourselves and move about in the office, our posture, our movements, what attitudes that we're expressing as well. And then facial expressions are a huge portion of nonverbal communication. If we have a look of disgust on our face when a person is telling us about their dental issue, that is not coming across in a good manner to our patients. So we always want to keep in mind how our facial expressions are coming across. Listening skills. So to be a good listener, we need to not let our mind wander while the other person is talking to us. We don't want to concentrate on formulating a reply while the person is talking, because we need our brain to take in every bit of information that they say before we can then build a response. We need to look as well as listen. Do not stereotype. Be careful of selective hearing, because if you're only hearing bits and pieces of what they're saying, you may be missing very important parts. And do not get impatient. Let them have their time to say what they need to say. You'll get your time to talk soon. Communicating with colleagues. So working in a positive, challenging, stress-free environment is what pretty much everyone wants when they think of their place of employment. A patient can tell right away if that harmony level is off in a dental office. So they can feel those bad vibes if things just aren't, like the office just doesn't get along. The patient can tell. The one key to a successful work environment is teamwork. We need to all work together. So working in a dental office can be stressful at times because you are dealing with the general population, and just customer service jobs are a little bit difficult sometimes when you have to deal with upset patients. So communication is kind of at the base of how you handle stress, whether it's in your personal life or your work life. The dental atmosphere can be a very stressful environment, and by having these proper communication skills, you can better handle how you deal with stress. So what are some causes of stress in the dental office? Lack of sufficient staff. You may be shorthanded up front, or even in the back, the assistants may have called off sick today, and the doctor's running very behind. That can be very stressful for everybody. Appointment overbooking, just having too many patients there at one time. Multiple tasks required simultaneously. So say that you're working on filing a claim for the insurance company and the phone's ringing off the hook and the dentist is asking you questions and an assistant is bringing up a patient to check out with you. That puts your brain on overload mode, and it can be very hard to try to slow down and take a breath and do one task at a time. Lack of good communication can be stressful as well. And then also perceived lack of job advancement, if you just feel like you're swimming in the water and just not getting anywhere. So being a positive team member is very important as well while you're working in the dental office. You want to be flexible and receptive to altering the way responsibilities are performed. You should be self-confident and use self-initiative when it comes to get things done. You don't want to have to rely on other people, because that can upset them and make them feel like they're doing too much work and you're not doing enough work. Show appreciation to your coworkers. Think before you speak. Don't let your emotions get overly involved. Remember that the first impression is not always the right one. Share the ups and downs of the day, and your way may not be the right way. Methods of stress reduction. You can reduce stress by maintaining a lifestyle that includes regular exercise, taking time for yourself, leaving the office behind at the end of the day. Leave your work at work, come home, and enjoy your private time. eating properly as well, setting realistic expectations. Next, let's talk about conflict among coworkers. So if you are facing a difference or conflict with one of your teammates or coworkers, it can create stress for you. So learning how to work through these conflicts or differences is important because obviously you want the work environment to be as stress-free as possible. Conflict is necessary though. It helps you develop your problem-solving skills and also helps you build your interpersonal relationships better. If we all just got along all the time, it would almost feel fake. Everyone feels differently, has different opinions on things, has different beliefs. So being able to work through those conflicts really helps us to build ourselves as a person. Unfortunately, though, unresolved conflicts tend to escalate. So if they are left unresolved, things will just get worse and worse and worse until one day you eventually just blow up on your coworker. That's not what we want. We want to work through these conflicts early on. Communicating with patients. So obviously effective communication, we just talked about it being super important for all aspects in the dental office, but most importantly when talking to our patients. They're not going to feel satisfied with their care if we're not communicating appropriately with them. So patients who have good relationships with their dentist and their dental staff are likely to stay with the practice. They're not going to look for care elsewhere. They will accept the treatment presented to them because they trust the people's opinions. They will pay for their treatment on time as well. They'll also refer other patients to the practice. That's great for word of mouth. When a patient is experiencing good communication, they're going to tell their friends and family about that. Patient needs. So patients build their relationship with the dentist and dental staff through confidence and trust. Patients base their perceptions about a practice on the following factors. How they're treated on the phone. So when they first call in to set up an appointment, if you're rude to them, if you belittle them at all for not coming to the dentist in the last 5 years, they're going to take that to heart and they're going to remember that. So definitely want to give them the best experience possible. How they are greeted. So when they walk through that door for the first time, they want to see smiling faces. They want to see positive faces. They want to feel welcomed. How they're made to feel in the office. So if they feel like they're being judged at all, looked down on for any reason, they're not going to feel really great about the office. How efficiently the staff manages business aspects such as billing and insurance. If a lot of mistakes are being made with their insurance claims or they're being billed for too much and they catch the mistake, they're going to start to lose trust in the office essentially. So we need to make sure that we are properly documenting, properly communicating to make sure those issues don't happen. So next, let's talk about a patient's psychological needs. Like mentioned previously, you're going to come across a lot of patients who just flat out hate being at the dental office, and that's understandable. It is a very scary place for some people, more so with the fear of the unknown, that they just don't know what to expect when they're there. These psychological needs can be more obvious when a person appears very tense or suspicious, apprehensive, resistant to suggested treatment. You can tell that they're anxious and nervous. One major factor is the patient's current life situation. So those who are experiencing more challenges at home will show more anxiety in the dental office. Even past experiences are huge too for patients. If they've had one bad experience in the past, they're going to carry that with them for a long time. Other important factors include, of course, their previous dental experiences and their attitudes and beliefs about the importance of his or her own teeth. If they don't feel like their smile is that important to them, they're not going to care a lot about what work needs done or if they have a cavity. If they do take pride, though, in their oral health and they want a nice smile and they're worried about aesthetics, they're obviously going to care a little bit more about their dental experience. So going more into patients with anxiety and fear of pain, for many patients, it's not actually the pain itself that makes them hate the dentist, it's the expectation of pain. More so the fear of the unknown. They're just waiting any second for that pain to start, and that's what is making them nervous. So there's two different types of fear here. There's subjective fears, also known as acquired fears, that are based on feelings, attitudes, and concerns that have developed at the suggestion of peers, siblings, parents, and or other individuals. So they may have not experienced these fears, but others told them about it. We see this a lot when we're dealing with kids, especially, and the parents almost try to prep them for what's to come in the appointment, especially when we're doing fillings on kids, and the parents like, oh, here comes the shot, like, don't even tell them about the shot. Now they're fearing that a shot is coming, and that's what's making them nervous. There's also objective fears, also known as learned fears. They are related to the patient's direct experiences and his or her actual memories of those experiences. So something happened to them in the past, and they're carrying that with them in the future. So, of course, there's dental phobic patients. I'm sure even some of you in this class hate going to the dentist. For some patients, even the mere suggestion of a routine dental visit can bring an overwhelming sensation of panic and terror. Even if they know it's just a cleaning, people freak out. So what can we try to do to help these people? A lot of times, these patients, they will just avoid going to the dentist for years, and that's not what we want. Because then they're going to come in with a lot of problems and therefore fear the dentist even more. If they keep coming periodically, they'll be left with less major long-term issues at the end of the road. So our ideal situation is to just make people feel welcomed and have a pleasant experience. It's always a great feeling when a patient leaves and they're like, wow, that wasn't as bad as I thought. You've actually changed my opinion on the dentist. I actually enjoy coming now. That's the greatest feeling for me, because people can carry this dental trauma for years. They may have experienced something when they're 7 years old, and now they're 77 years old and still think about that experience every time the word dentist is mentioned. We don't want that. So these people that just fail to seek treatment regularly, they may turn to an urgent care or even an ER when they have dental issues, just because they literally hate going to the dentist. So when a patient is feeling anxiety or stress about coming to the dentist, their responses may not be the most welcoming to you. So it is important to try to remember that you're not the target that they're trying to aim for, and you shouldn't take things personally, because they are just trying to get out, essentially talk about their fear, and sometimes it does feel like you're the one that they personally hate, and that's not the case. They just hate the experience. So patients' responses can be influenced by the patient's personality, their background experiences, their previous experiences as well. Also, a patient's response to the situation can result primarily from causes that are not part of the present situation. So again, just having bad past experiences can affect them for years to come as well. Even if they're having a bad day at work, sometimes they're coming from work, they're going to their dental appointment, and they just may be in a really bad mood. And it's not from even you, it's just because they had a bad day at work. So keep that in mind as well. Patients' anxieties concerning treatment may result in hostile, irrational, and inappropriate behavior. Sometimes patients, you may have heard the word Karens being used, sometimes patients just are naturally just miserable, and everything around them is miserable, and that's just how they go through life. And sometimes there's not much you can do, just try to be your positive, upbeat self, and they leave and you're like, wow, that person just hates their life. And some people are just like that, unfortunately. And hostility is an expression of a patient's anxieties and is not caused by or directed at dental personnel. So again, some people are just like that. Nothing you did, nothing really that you can do except just try to give them a good experience and keep them positive. Physical and mental needs. So maintenance of high standards requires sensitivity to the patient's physical and mental needs. The patient registration form and the medical dental history form should include questions about the patient's dental and medical health. That just gives us a good understanding of who that person is and where they're coming from before we even get to meet them. Patients with physical or mental impairment have complicated and special needs that must be considered before and during provision of dental treatment. So if they are a disabled person, we need to take that into consideration just to make sure we give them the best experience. So another major area of stress for patients is the finance aspect of it. Dental is an expensive practice. Dental insurance costs are high, and so people can become very agitated when they're required to pay. So patients may believe that fees are too high, they're unable to afford the treatment, they just don't need the treatment, it's just not worth the money. And many people do not equate dental care with basic human needs such as shelter and food. Another thing that makes it very difficult is that medical insurance and dental insurance are two completely separate entities. So it just makes people feel that dental is not all that important, which in turn, they just don't prioritize that treatment. Getting people to understand, though, the benefits and advantages of appropriate treatment requires good communication skills. We need to let them know the benefits. We need to let them know that if they prioritize their dental health care, they're going to end up spending less money because they are catching things when they're little versus waiting too long and being stuck with big root canals, crowns, things like that. So if they would just take care of their teeth when issues are small, they would actually be saving money. So how can we meet our patients' needs? First, we should create a warm, welcoming, positive atmosphere for them to come into when they step inside the dental office. We should be sincere in all of our interactions. Patients are very sensitive to tone of voices and any remarks that can be misinterpreted, so just make sure that you're remaining sincere in all your communications. Show respect to them, whether it's with their time or just in general. Make sure that your appointments are staying on time and appointments aren't scheduled overlapping on each other, because patients are going to be really upset if they're sitting there waiting in the waiting room forever because the doctor is running behind, and it happens on every occurrence that they're at the office. Resolve complaints and misunderstandings. Patients will sometimes get upset. It may be finances, it may just be that they're already stressed coming into the dental office. So one of the best ways to calm an irate patient is just to listen to them. Just use eye contact when they're talking to you, occasionally nod your head. They just want to know that someone's listening to them. Do not interrupt them, let them finish what they need to say, and then you can respond back. Next we have remain approachable. So we don't want to be sitting there with an angry look on our face or talking in a rude, demeaning tone. We want patients to feel comfortable enough to just come up to us. And then also respecting patient confidentiality. Obviously, it's very important that we're not sharing a patient's information with other people. We're respecting the HIPAA laws, things like that. Phone skills. So as a treatment coordinator, it is going to be the receptionist's main duty to be answering phone calls, especially for new patients or patients scheduling appointments. It's one of the most important jobs that you have. So obviously you're going to be using the phone for a lot of this communication. Most patients make their first contact with the dental office by phone. They're going to call in to schedule that new patient appointment. So on the basis of this first patient contact, the patient then forms their opinion of the practice. If you answer the phone and you're rude and just unpleasant and you're acting like they are just ruining your whole day, that's their first impression of the office. They're going to feel very unwelcome there, not going to have the best experience right off the bat. So we need to be very pleasant, uplifting, excited that they chose our office, just really trying to make the best experience possible for them. This opinion also reflects on the dentist and the dental team, and even on the quality of care provided, even though no care has been provided yet. So I've seen patients leave really bad reviews for offices just because that first phone call, the person was just rude to them, and that's never good. That's never a good feeling. No one wants to go to a doctor that their staff treats them poorly. So that first phone call is everything. Next, let's talk about proper etiquette. So smile. It shows in your voice. If you are having a very mean look on your face, your voice is going to reflect that. If you have a smile on your face, you're going to just sound more positive and really just joyous. So smiles are often contagious as well. Patients see you smile, they want to smile back. It just all around happiness, friendliness, warmth is shown in a simple smile. Never chew gum, eat, drink, or have a pen or pencil in your mouth while you're talking on the phone, because it can make you sound mumbled or just distracted, and that's not what we want the patient to hear. Speak directly into the phone. Speak clearly and slowly. Ask the name of the person who's calling and talk to him or to her, not to the phone. So if you ask their name and then while you're communicating with them, just be like, okay, Mrs. Smith, I'll look right into that for you, and then the doctor will call you back shortly. Thanks, Mrs. Smith. Have a great day. Just that personalization really puts you above and beyond. And then when completing a call, always allow the person who originated the call to hang up first. This ensures that they don't have any remaining questions, the reason they called is taken care of, and just sets the overall positive tone for the call as well, that they feel like they're in charge of things. Incoming calls. So the phone should be answered promptly, preferably after the first ring. You don't want the patient to sit there and the phone's ringing 20 times and they just feel like no one's ever going to answer them. Use the wording preferred by the dentist at your practice. Typically they are going to tell you, or even the staff that is treating you are going to tell you what they expect out of the conversation. So usually they have a set, I don't want to say schedule, but a prompt that they would like you to use, where they'll be like, okay, first you're going to introduce yourself and say, this is Dr. So-and-so's office, how may I help you today? They want you to use like very consistent wording with every patient, just to make sure it does stay consistent. Greet the patient pleasantly, identify the practice and yourself, ask how you may help the caller. Working with difficult callers. This is always the most fun part of taking phone calls. A lot of patients will call in because they're upset about a bill they may have just received in the mail, or maybe they broke a tooth or they're having tooth pain. They were up all night in just crazy pain and now they're calling you and they're not in a great mood. So listen without interrupting them. They just usually want to get things off of their chest to start, and if you start interrupting them, it's going to agitate them even more. Gather all the necessary information, take note of details as well, and sympathize with the caller. Maybe just say, oh my gosh, I can imagine how painful that tooth must be right now. I'm so sorry to hear that. By treating them this way, it makes it seem like you genuinely do care about how they're feeling right now, and that you understand why they are upset. Try to stay calm as best as you can. Your heart may be racing, but you don't want to see that you're sweating at all because of this conversation. Remember that the caller is ultimately a patient of yours, so how you handle this call could result in the patient either continuing to have a relationship with the office or deciding to go elsewhere based on this interaction. Placing a caller on hold. So before placing a call on hold, ask them for their permission. Just say, hey, can I put you on a brief hold while I find out this question for you? Most of the times they'll say yes. Wait for the caller's response before pressing the hold or mute button. You don't just want to say, hey, can I put you on hold, and do it before they even get a chance to say anything. That comes off very rude. Always be courteous and do not expect the caller to remain on hold for longer than a few moments. They're going to get agitated that they're on the phone this long and not getting any answers, so a lot of times they just end up hanging up. If necessary, ask whether you can return the call or give a specific time when you will call them back instead. That way they know when to expect your call. Just a little tip, next time you call your doctor's office or anywhere really that puts you on hold, check how long they keep you on hold and how you feel about it. I can almost guarantee the longer that you're on hold, the more agitated you become. Our patients feel the same way. Callers wanting to speak to the dentist. So we sometimes have patients that ask to speak directly to the dentist. Well, the dentist is very busy. He is doing a lot of hygiene checks, he's doing restorative appointments, he is writing notes and looking at x-rays. Like, he's got enough on his plate, he may not be available to speak to the patient right now. We especially don't want to interrupt the dentist while they are working chairside in order to just come to the phone. So phone interruptions could reduce productivity and cause treatment delays. Are inconsiderate to the patients that are actually there expecting the doctor's full attention at that moment. Make it difficult for the dental team to maintain infection control protocols because their flow is just knocked off of the usual schedule and it could cause them to make an error. The most common exceptions for which a dentist should come to the phone are to talk with another dentist, the laboratory technician who may have a question about their case, or an immediate family member in case there is a family emergency. But it is important for the treatment coordinator to know what the dentist policy is on this and how to handle those calls tactfully. Usually you're just going to say, Dr. So-and-so is unavailable at this time. Could I get your name and phone number and take a message for him to call you back when he is available? More often than not, they'll be fine with that. And if they're not, that's tough. He really can't be interrupted right now. So that's their option, is to either have the doctor call him back later, or I guess their question isn't being answered. Taking messages. So make a written notation of all incoming calls, particularly those that require further action. If you need to ask the dentist a question or the laboratory a question, write that down. That way you're getting accurate information. Many practices use a printed form or a phone log to organize this information. At the beginning of the conversation, note the caller's name and then ask them the appropriate questions. If you promise to follow through on a call, make sure you're actually following through. Don't say, yeah, let me check into that for you, and then never check into it, because the patient will obviously become a little bit upset. And then when the dentist is expected to return a call, make sure you are letting the patient know, or the doctor know, the patient's name, and have the patient's dental records ready to go. That way the dentist can just immediately look at the information he needs to. He doesn't need to fumble around looking through the patient's chart for the information. Emailing and automated dialing services. So there is email etiquette. You want to mind your manners, watch your tone, be concise, make sure your spelling and grammar is all correct. Ask before you send an attachment, and wait to fill in the to email address until you already type the whole message and proofread it, because if you put the email address in and then type your message, say you accidentally bump the send button and maybe an incorrect message goes out, one that looks unprofessional, we don't want that. So finish typing your message first and then add the patient's email very last, right before you send it. With a patient appointment phone reminder service, patients can be contacted in a professional manner, reminding them of their upcoming appointments. Now, this is very helpful for patients who may not write down that they have appointments. They're relying on these phone calls. Sometimes they can become too excessive, though, so make sure your office isn't over sending these reminder phone calls. Text messaging. So texting is all around us these days. A lot of offices will use texting reminders instead of phone calls now, because it's automated and can be sent to a large mass of people at one time. You can use it for quick reminders, alerts, and appointment confirmations. It can also be used to notify a patient that the office is running late for an upcoming appointment, and that maybe they want to go grab some coffee quick or a bite to eat before their appointment, just so they're not waiting in the waiting room for longer than needed. So in the dental office, we'll often send business letters to our patients. An appropriate business letter is essential when conveying a professional image. A lot of the times it'll say the dentist office name in the header, the dentist that worked there. It'll look very professional. Every letter or correspondence mailed from your dental office must be produced on high quality, professionally designed stationery. Letters should be concise, accurate, and neat, and should also be proofread for spelling and grammatical errors, because misspelled words, grammatical errors convey an image of the office that it doesn't care about the quality that it's outputting. That's not what we want. So many practices send letters to welcome new patients to their practice, to congratulate them, maybe a wedding or a baby, to acknowledge a referral. So if a patient refers one of their friends or family members, we often send a thank you letter to them, just saying that we appreciate their good word of mouth to their family and friends. After completion of an extensive case, if a patient needs to schedule a continuing care appointment or recall appointment, if a patient misses an appointment, we can send them proposed treatment options, and also to collect any payments they may have. Letters to insurance carriers. So when completing written correspondence to insurance carriers, make sure the following items are included. Patient identification information, which can include the patient's name, address, and contract number or ID number for the insurance company. Case information, and then radiographs are included if they are required. Marketing your dental practice. Marketing encompasses all activities involved in attracting new patients to the practice and retaining satisfied patients. Initiation and developing of a marketing plan are the responsibilities of the dentist, or if they have a marketing team, it would be their responsibility as well. For a marketing plan to be successful, all members of the dental team must be actively and enthusiastically involved in planning, implementing, and monitoring it. So can you think of some methods of advertising that could be possible in a dental office? I can think of newsletters, giveaways, thank you notes, having an open house, any direct mail, flyers, things like that are all great ways to market. Goals of practice marketing. So the primary goal of the marketing plan is to create a positive image of the practice where patients receive quality treatment in a caring atmosphere. The positive and cooperative attitudes of all staff members are vital in order to successfully create this positive image. A secondary goal is to also enroll new patients at the practice. And an important part of achieving this goal is to determine the perceived needs of potential patients and seek out the ways that these needs can be met. Logistics of marketing. So most practices with successful marketing programs attribute this success to good organization, attention to detail, determination of a budget, and tracking the results. Written goals and dates must be established. You don't want to just say, we'll have a deadline of whenever. Set a deadline, set a goal, that way you have something to work towards. The marketing budget usually ranges between 3% and 5% of the previous year's gross revenues. So if an office is making more money, they have more money to spend on marketing. If it's a smaller office that doesn't see a lot of patients, they may not have as big of a marketing budget. And then tracking responses will help determine that success of the marketing plan. Types of practice marketing. So there are external marketing activities which take place outside of the office and are directed at people who are not already patients. So this could be health fairs, presentations to school children, or senior citizen groups. External marketing activities may also require staff members' participation in the community. And then there's also internal marketing activities, which are targeted to patients who are already in your practice. So they could include a practice newsletter, sending flowers or thank you gifts to those who refer new patients to the practice, or even sending a birthday or special occasion cards to patients as well. And then lastly, giveaways. Those are sometimes good to give away toothbrushes, or I've seen water picks be given away, just as a way to keep patients engaged and wanting to come back to the practice.